Hello everyone, my name is Dustin and I live in South Korea. Until now, Korea has been quite successful in containing the COVID-19 outbreak with symptomatic testing, tracking, and quarantine management systems. Importantly, Korea did not enforce a complete lockdown, so many companies have continued operating, meaning they have also played a crucial role in preventing the spread of coronavirus. This is especially important given that many companies around the world will now start opening again. Let's take a look at some of the safety measures put in place by one company located in Daegu, which was at the center of the coronavirus outbreak in Korea.
Hello, I'm Erin and I live in Daegu, South Korea. In February of this year, Daegu became an epicenter of the COVID-19 outbreak, with many cases occurring every day. MIR Implant Company, they were able to continue to remain open throughout the outbreak without having any COVID-related infections. Today we're going to investigate how MIR was able to stay open and keep their employees safe. Let's go inside. We start with the self-operating disinfecting misting machine. This was designed within MIR in order to make sure that their employees coming off the street do not have any bacteria or viruses on their clothes or belongings. Next, we can get a mask if you don't already have one. In Korea, most people are wearing masks everywhere they go, but if their employees need a new one, MIR provides them. We then have an antibacterial, antiviral disinfectant sanitizer, and you put that on your hands and let it dry. The next step is to do a thermal imaging of your temperature. If you have a temperature higher than 37 degrees, then you will have to use a contact thermometer to double check. Once you're sure that you don't have a fever, employees come and they record their temperature twice a day, keeping track. Put your name and your temperature under your team name. Then it's off to work.
At MIR, the air and surfaces are disinfected 3 times a day, once before work, during the lunch break, and after work. Plus, extra care is taken cleaning elevator buttons and door handles. For meetings, they use video conferencing, even within the same building. And when face-to-face meetings are required, everyone wears a face shield. Instead of using the cafeteria, all meals are boxed and eaten in the office, and any chatting outside during breaks must observe social distancing. As a healthcare company, MIR already used strict hygiene and disinfection protocols. But since the COVID-19 crisis, they have doubled their standards just to make sure that all the staff and products remain safe.
The main disinfectant used by MIR Implant Company is hypochlorous acid, or HOCl. To find out more, let's talk to Wong, the director of MIR International Network for Education and Clinical Research.
Hello everyone. Based on the success of the HOCl infection control protocol used at MIR Clinic, we've actually received so many inquiries. Therefore, first, I just want to mention a couple of things about why we are using HOCl. At this point, we know that the new coronavirus, or SARS-CoV-2, is an enveloped virus that relies on a rather weak protective lipid coating, which supposedly makes it easier to kill compared to non-enveloped viruses such as norovirus. Although there are no direct studies on the ability of HOCl to kill SARS-CoV-2, HOCl has previously been shown to deactivate the harder to kill norovirus, which is why HOCl is listed by both the US and EU EPA as presumed to be effective against SARS-CoV-2. Now, let's look at the HOCl we are producing. There are 2 important indicators for HOCl, the pH and the ppm, or parts per million. First, when making HOCl, we check for a neutral pH between 5.0 and 6.5. This is important as the pH indicates which species of chlorine is present. A neutral pH indicates the presence of hypochlorous acid, HOCl, which is what we want, whereas a higher pH means the presence of more hypochlorite ions, which is essentially bleach, while a lower pH indicates more chlorine gas. The neutral pH also means the solution is harmless to humans and the environment. Second, we make sure that the ppm, or parts per million, of chlorine is between 50 and 100. This is important as the ppm determines the disinfecting power, where studies have shown that below 50 is not as effective, while up to 100 is safe for humans and surfaces. At MIR Clinic, we use the same strength of HOCl, that means between 50 and 100 ppm, for all our surface cleaning, misting, and fogging. Plus, the presumed kill time, which means the time it takes for HOCl to kill SARS-CoV-2, is less than 10 seconds, based on previous studies with other viruses, such as norovirus. It's really that fast, which is important and impacts the cleaning time required between patients. The HOCl we are using is made with a SLB 120 machine that produces 120 liters of HOCl per hour. So this machine is definitely more appropriate when large quantities of HOCl are required. The starting material is 3% diluted hydrochloric acid, which is mixed with water and electrolyzed to make HOCl. This machine can be operated with various voltages, from 110 to 230 volts, making it internationally friendly. However, the eClean 50 is clearly more appropriate for individual clinics. In this case, the starting material, the Kedolite reagent, is already included. And remember the importance of measuring the pH and the ppm? Well, the eClean 50 package also comes with special safety indicators to make sure the pH and the ppm are correct. So I tried using the eClean 50, which works and looks just like a kettle. To make half a liter of HOCl, you just add 1 milliliter of the Kedolite reagent, which is a really small amount, to 500 milliliters of tap water, not distilled water. Then you press the button once, and 3 minutes later, you have neutral HOCl with a ppm between 50 and 100, which of course you can test and confirm yourself. As the tap water pH differs in different countries, it's good to experiment and find the correct ratio. It took me a couple of tries to get it just right, but actually it was quite easy and straightforward. Again, the eClean can be operated with various voltages, so no problem. One more issue. You need to store your HOCl in a light-resistant bottle and use it within 2 weeks, as HOCl is inherently unstable, which is partly why it's so effective as a disinfectant. Of course, there are various machines on the market that can produce HOCl, but if you're interested in the equipment we are using, please contact us directly at this address. The unit prices for the equipment we have shown in this video are as follows: 185 euros for the eClean 50, 1,450 euros for the Corona Shield HOCl misting machine, which is fabulous. The shipping cost is additional and will depend on the weight of the product, and of course everything will be shipped priority. Since all these items are customized and in high demand, it will take about 2 weeks to prepare, plus the shipping time. Bottom line, as you can see, this type of infection control is very economical and flexible, and it has already been shown to work. So you, your staff, and your patients can all feel safe and confident. That's the key.